presentation will demonstrate the major skeletal features of the human skull, with particular attention to those of the face. The skull can be divided into a cranial and a facial portion by a line passing from the roof of the orbit to the mastoid process. The facial portion is primarily concerned with mastication and forms the skeleton of the oral cavity. However, both it and the cranial portion are involved in the structure of the orbital and nasal cavities. Before discussing the role of the individual bones, a few of the prominent features of the face will be demonstrated. Superolaterally are the orbital cavities, whose floors are facial bones, and roofs and much of their walls cranial bones. Medially is the lacrimal fossa. Above the orbital margin is a superciliary ridge. Below the orbits, the major part of the upper face is based on the maxilla. Its inferior, or alveolar portion, accommodates the maxillary teeth. The maxilla also frames most of the aperture of the nasal cavities, with the nasal bones forming the bridge of the nose. At the lateral margin of the orbit is the zygoma, forming the prominence of the cheek. With a temporal component, it completes the zygomatic arch, or cheekbone. Above the zygomatic arch is the shallow temporal fossa of the cranium. The mandible forms the lower jaw. With the maxilla, it provides the main skeletal framework of the oral cavity. It has a horizontal body and a vertical ramus that meet at the angle. The upper, or alveolar portion of the body houses the mandibular teeth. In the anterior midline, at the mental symphysis, its inferior part forms the mental protuberance of the chin, the point of which is the menton. The upper part of the ramus has an anterior coronoid process and a posterior condyloid process. The latter articulates with the temporal, a cranial bone, at the temporal mandibular joint. Deep to the ramus is the infratemporal fossa, whose medial boundary is the lateral pterygoid plate of the sphenoid. The facial skeleton consists of 14 bones, 2 of which are single and 6 paired. The dominant bones are the right and left maxillae and the single mandible. The other single bone, the vomer, and all other paired bones, the zygomas, palatines, inferior conchi, nasals, and lacrimals, articulate with the maxilla. The isolated maxilla is now seen from the medial aspect, with the aperture of its sinus, from the lateral with the infraorbital foramen, from the superior with the infraorbital groove, and from the inferior with its horizontal plate. The maxillae are now seen in place. They are pyramidal in shape, with the apex toward the zygoma. The medial surface, or base of the pyramid, forms the lower lateral wall of the nasal cavity. The lateral is that of the face anteriorly, and of the maxillary buttress and anterior wall of the infratemporal fossa posteriorly. The superior is that of the floor of the orbital cavity. Inferiorly, the horizontal plate of each maxilla forms the anterior hard palate, medial to the alveolar processes. Thus, the maxilla is concerned in the formation of the orbital, nasal, and oral cavities. The facial portion of the orbital cavities is formed by the zygoma laterally and the lacrimal medially, with the maxilla between them. As already demonstrated, the maxilla forms most of the orbital floor. The zygoma articulates with it and forms part of the lateral wall. The lacrimal, with the maxilla, forms a fossa at the inferomedial orbit for the lacrimal sac. This leads into the nasal lacrimal canal. Other cranial bones complete the bony orbit. The ethmoid forms much of the medial wall. Posterior to it, the sphenoid completes this wall, with a small contribution from the palatine, another facial bone. The sphenoid also completes the lateral wall behind the zygoma. The frontal forms the roof. It has a slight depression laterally for the lacrimal gland. Posteriorly, the optic foramen opens into the orbit with the superior orbital fissure just lateral to it. Both traverse the sphenoid. Between the maxilla and sphenoid, the inferior orbital fissure passes forward in the orbital floor from the infratemporal fossa. The nasal cavities are related to the nasals, inferior conchae, vomer, and palatines, as well as to the maxilla. As already mentioned, the external apertures have margins largely formed by the maxillae, which form an anterior nasal spine where they meet in the inferior midline. The nasals complete the margins above. Through the apertures, the inferior conchae are seen, projecting medially. The nasal septum, separating the two cavities, lies more or less in the midline. In the sagittally sectioned skull, the vomer and the perpendicular plate of the ethmoid are seen. With the internal projection of the nasals, these form the bony nasal septum. This is completed anteriorly by cartilage in life. After removal of the nasal septum, the conchae of the right nasal cavity are exposed. The superior and middle are parts of the ethmoid. The inferior is a separate facial bone. The conchae project medially from the lateral nasal wall, which they obscure. The lower part of this wall is formed by the maxilla, with the palatine posteriorly. The upper part is formed by the ethmoid. Between the wall and each concha is a superior, middle, and inferior nasal meatus. Above the superior concha is a sphenoethmoid recess. As mentioned previously, the horizontal plates of the maxillae form the anterior hard palate. Similar plates of the palatines complete this posteriorly. Anteriorly, in the midline, is the incisive canal, and posteriorly on each side, the greater and lesser palatine foramina. Immediately behind the palate are the lateral and medial pterygoid plates of the sphenoid. The medial has a hamulus. The hard palate is both the floor of the nasal cavities and the roof of the oral cavity. Cavities, or paranasal sinuses, occur in the maxilla and in three cranial bones, the ethmoid, frontal, and sphenoid, but the surface location of the latter is not apparent in this view. Each maxillary sinus is, like the maxilla itself, pyramidal in shape. The apex lies deep to the facial prominence of the zygoma. The The base is the lateral wall of one nasal cavity. Each sinus also has a facial, infratemporal, orbital, and alveolar wall. Through the latter, roots of posterior maxillary teeth may be extruded into the sinus in dental extractions. The ethmoid sinuses lie in the labyrinthine part of the ethmoid bone, deep to its orbital plate. Unlike the other sinuses, each ethmoid sinus consists of 10 to 20 individual cells. The two frontal sinuses lie behind and above the superciliary ridges. They are separated by a bony plate. In the section skull, the right sphenoid sinus is seen. It lies deep to the sella turcica of the cranial floor in the body of the sphenoid bone. The right frontal sinus is also visible. Here, part of the middle and inferior conchae have been removed. Under the middle concha, part of the medial wall of the maxillary sinus, or lateral wall of the nasal cavity, is exposed. It is crossed by the uncinate process of the ethmoid. However, most of the apertures seen are closed in life by mucosa. The hiatus semilunaris runs horizontally. Anteriorly, the frontal sinus and anterior ethmoid cells open into it. Posteriorly, it has the maxillary ostium. Between these openings and above the ethmoid bulla, the middle ethmoid cells open. Posterior ethmoid cells open under the superior concha, and the sphenoid sinus opens above this in the sphenoethmoid recess. Under the anterior end of the inferior concha is the termination of the nasolacrimal canal. The oral cavities are related to the palatines and mandible with the maxillae. The mandible is horseshoe-shaped. At the anterior midline of the body is the mental symphysis, where the two halves fuse in the first year of life. The external surface shows the mental foramen, lying below the second premolar. From this region, an external oblique line runs up and back to the anterior border of the ramus. The inner aspect of the mental symphysis has two sets of paired genial tubercles. The superior gives attachment to the genioglossus and the inferior to the geniohyoid muscles. A digastric fossa lies just lateral to and below the tubercles. It gives attachment to the anterior belly of the digastric muscle. From the region of the tubercles, an internal oblique ridge, or myelohyoid line, runs up and back to end near the alveolar process of the third molar. Just above this, on the ramus, is the mandibular foramen with the overlapping lingula. As the inferior alveolar nerve enters this foramen to traverse the bone in the mandibular canal and supply the mandibular teeth, injection of anesthetic in this area will block sensation from these teeth. A submandibular fossa lies below the posterior part, and a sublingual fossa above the anterior part of the myelohyoid line. At the angle formed by the body and ramus is a lateral and medial roughening for the attachment of the masseter and internal pterygoid muscles of mastication, respectively. The ramus ends superiorly in an anterior coronoid process and a posterior condyloid process, with the mandibular notch between them. The coronoid process gives attachment to the temporalis. The condyloid process articulates with the mandibular fossa to form the temporomandibular joint. The fossa is shallow, but its anterior margin is raised as the articular eminence. In opening the mouth, there is a forward gliding movement of the condyle onto the articular eminence, with an accompanying hinging motion. This is accomplished by the external pterygoid, the fourth muscle of mastication that attaches to the neck of the condyle and articular disc of the joint. In excessive action, the condyle may be dislocated into the infratemporal fossa. This concludes the presentation of major skeletal features of the face.